medical coding change that could limit options for some women fighting breast cancer.
Women should not be asked to pay cash for this surgery.
Our ability to choose what reconstruction options are right for our body is drastically at risk right now, but we as a community have the ability to change that. The people that make these decisions rely on us not to care or understand these things so that way they can make these decisions about our bodies without us really understanding or knowing. But that's not happening on my watch. So first we need to understand the basics of medical coding to understand what's happening. Medical coding is used all over the world. As patients, our diagnoses, our test results, and treatments all must be documented, not just for reimbursements, but also to ensure that we're getting the most high-quality healthcare possible. CPT stands for Current Procedure Terminology, and it's the most widely accepted procedural coding used across the country. CPT code set has been used for over 50 years for healthcare professionals to communicate about the procedures they perform. This code set is owned and maintained by the American Medical Association, AMA, and it includes more than 8,000 codes describing services provided to patients. In order to ensure that these codes meet the needs of everybody that uses them, they're constantly being maintained, modified, and updated. To keep everybody in the loop, AMA publishes CPT coding guidelines each year to support medical coders with coding-specific procedures and services. So how is this impacting the breast cancer community? Well, until recently, modern flap surgeries all had their own unique billing codes. So microsurgical breast reconstruction procedures such as the Diep flap, the PAP flap, the TAG flap, they all had very specific unique codes that were used for billing. This is really important. These codes were all called S codes. These codes are administered by Medicare and Medicaid Services, CMS, which is a federal agency, and these codes are used by doctors to bill insurance and also determine how much doctors are reimbursed for certain procedures. Basically, these codes mean everything to doctors that use insurance. And thanks to the Women's Health and Cancer Rights Act of 1998, all group health plans and health insurance companies, including HMOs that cover mastectomy, also cover all stages of breast reconstruction, which is amazing. So if you've had a mastectomy that was covered by insurance, legally, you are entitled to have all of your stages of reconstruction also covered by insurance as well. But the problem here is that even if legally our reconstruction is protected by insurance, the type of reconstruction is not protected, and that's what's at stake here. If you're impacted by breast cancer, your ability to choose which reconstruction is right for you and your body is seriously under attack right now. Let's get into it. For years, modern flap surgeries had their own unique codes that were used to bill insurance. This was important because each flap surgery takes a different skill set, a different amount of time, and different expertise to perform, and thus costs a completely different amount of money. A Diep surgery is a highly specialized surgery that's very expensive, and for a good reason actually. For example, a Diep flap surgery takes a lot more time, expertise, and precision than a tram flap surgery. In general, when a surgeon's performing a Diep flap surgery, they're going to have to apply 275 microsurgical clips onto vessels, whereas a tram flap is only going to need 20 of those. 275 versus 20. So why does this matter? Well, first of all, it's your body and it's your choice, and you deserve to have every single option available to you. None of us should have this taken away from us. And also, a lot of community members just prefer the Diep surgery for multiple reasons. For one, it doesn't tear our muscle. For two, a lot of community members cannot or do not want to have breast implants in our bodies. And three, it also involves using natural tissue, which is preferred by a lot of community members. Unfortunately, the ability to choose a Diep flap is getting taken away from us because now CMS has decided that a tram flap and a Diep flap should be categorized under the same code, when clearly a Diep flap and a tram flap are not the same. CMS, the Centers for Medicare and Medicaid Services, a federal agency, decided to combine all microsurgical breast reconstruction using a patient's own tissue under one umbrella code and eliminated the S codes. This means that moving forward, surgeons will only be able to bill insurance plans at the same rate as the free tram flap. Is this a problem? Tram flaps are much more invasive surgeries, are outdated, are associated with longer recovery and more risk of long-term complications, and take less time and expertise than a Diep surgery, and cannot be reimbursed for nearly the cost of a Diep surgery. So now that everything's under one code, surgeons can't afford to do Diep surgeries through insurance anymore. And this is a huge problem for the community. This means that fewer surgeons are going to offer these procedures that patients prefer and need. Patients that need Diep flaps will either have to pay out of pocket, which is over $50,000, or you're going to have to make a choice that isn't right for you and your body. Hard reality is this: Diep flap surgeries aren't going away. Our access to them is. If we don't urge CMS to please reverse this decision now. As a community, we have so much strength in numbers, and I feel so confident that if we come together, we can fight this. But we have to do this now. There seriously is urgency. So what can you do? Reach out to your local representative and your senators and tell your story. Why is Reconstruction important to you, and why do you feel like your choice matters? Head to the link in my bio for a letter to copy if you need it. Reach out to Dr. Elizabeth Potter. She is leading the charge here, and she cares about us so much. Email her at advocacy@drpotter.com or head to her website and fill out the form. Contact your insurance provider and let them know how important it is to you to have the choice when it comes to your reconstruction. Contact CMS and let them know how big of an error this is and how deeply this impacts you. Contact AMA and let them know how big of an error this is and how deeply this impacts you. Contact ASPS. Let them know how big of an error this is and how deeply this impacts you. They are supposed to be protecting us, and they aren't. Thank you so much for joining me in the fight against this. Together, I know we can make a change. It takes all of us, but I am so confident. I have hope. There are so many incredible people that are coming together to fight this. I know we're going to make a difference.